What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy, testing negative for the viruses, and, well, trying to have a great day so far. It is time now for the Friday edition of the Virus Update for Friday, August 1st, 2025. If you're new to my channel, welcome to my channel. Chances are you have clicked onto this video because you or someone you know is sick right now, whether it be COVID or something else. So if you want to stay informed with what's going on with COVID, because let's face it, the numbers are really going up again. In some cases, faster than we have ever seen. Want to stay informed with COVID and other viruses? Subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And if something triggers a thought, which I pretty much guarantee it will, leave a comment down below. Alrighty, we have a pretty busy Friday with some not so good news on many different things, including personal news as well. We'll get to that in a little bit. I mentioned one of the fastest rises ever for some areas. Get this. This is from Sci-Fi. Breaking. This was as of yesterday evening. CDC reports Region 6, Texas, New Mexico, Oklahoma, Arkansas, and Louisiana have the largest relative weekly percent increase in COVID positivity of the entire pandemic for the week ending in July 26th. Now, right off the bat, you're probably thinking, wow, COVID cases are going up that fast? Well, yes, they are going up fast, but there's another problem. These guys right here, at-home testing, and, well, look at the regions I just mentioned. And I don't like to get political, but look at these regions. And you know what? Actually, it doesn't matter what state you're in anymore. There's a lot of people not testing right now. And COVID is going up. And so you couple with people not testing, people doing the at-home test, and, well, perhaps a really big rapid rise in COVID. And yes, things are not going well. And let's face it here. A big part of this actually is COVID going up. You're going to see later in this video some new CDC data. It is absolutely going up at an alarming rate in the United States. And someone's probably getting ready to type, oh, you're a fearmonger. No, I'm not. Wastewater data right now shows there are a ton of people coming down with COVID at this moment here in the United States. It's not good, and it's continuing to go up. All right, moving on. We talked about this yesterday. I'm going to show it to you again because this is really bad. COVID and flu may awaken some cancer cells. So if you've had cancer in the past, you had your treatment, you've gotten better, you're now cancer-free, well, there's still some cells left in you, and COVID and flu may awaken these cells. There's millions of people that can say they have had or have cancer in this country. This is a big problem. We need to do something to address this. I mean, we need to take COVID serious again. We should probably be taking COVID as serious as we were back on day one. And am I saying right now the country should be shut down? No, I'm not saying that, because I get that saying, oh, we're not falling for again, we're not complying, this or that. No, I'm saying we need to be more cautious. We need to be aware of just what is going on with this virus. This virus is costing lives in more ways than one. This virus is also very expensive. More on how this virus is expensive in just a moment. Let's move on to other few stories first. Justin Timberlake reveals Lyme disease diagnosis. What are the signs and symptoms? And what other tick-borne illnesses can you get? You can get a lot of different tick-borne illnesses. You can get Rocky Mountain spotted fever. You can get a lot of different things. But he's not the only celebrity who's dealing with Lyme disease. I'm finding out there's probably about a dozen, if not more, that have dealt with Lyme disease. So this is a real problem. If celebrities are dealing with it, if they're getting the proper diagnosis for it, imagine how many people could potentially have Lyme disease and just don't even know it. It is a real possibility, especially if you live in rural areas, or maybe you're someone that likes to go up into the mountain regions, where you like to do a lot of hiking, even bike riding. Hey, ticks, they can jump off a tree, leap off of trees, get into your hair. It's a real thing. I've heard of cases of Rocky Mountain spotted fever happening from that waste. And Lyme disease is a real big problem. In fact, when I was coming back from vacation the other day, I went through Lyme, Connecticut, or East Lyme, Old Lyme, that area in general. That's where Lyme disease started, from what I understand. Lyme, it is a real problem. And, you know, with, I hate to go here, but with our changing climate, with things getting warmer, we're recently getting warmer, some of these weather patterns, all these different things changing. It seems like ticks are growing in population because I don't remember there being so many ticks here in Pennsylvania when I was a kid. At our property upstate, that my grandfather built many years ago, the tick population has just exploded. Yeah, and it is a real problem that we need to deal with. All right, moving on. 5 new measles cases in Osceola County. This is in Michigan. An outbreak has been declared. So just like that, 5 new cases right away. That's the sign, definitely a sign of an outbreak, and that's the sign of an outbreak that may potentially grow. Yeah, that's not good whatsoever. We're definitely going to be keeping a close eye on that. New data show whooping cough cases on the rise in South Carolina. The South Carolina Department of Public Health reports an increase in pertussis cases, commonly known as whooping cough, with 183 cases statewide as of July 30th, up from 147 at the same point last year. So whooping cough continuing to go up in South Carolina, and really it's going up all around the United States. All right, we have to talk about the cost of long COVID, because the situation with long COVID in terms of, people having to pay for treatments and whatnot, it's worse than I known it to be. And I knew it was really bad, but I didn't think it was this bad. So for those who don't know, I've been getting Xolair injections since 2023. Prior to going on vacation to visit my relatives up in Maine, I got a letter in the mail. Here's that letter right here. I'm just going to show you that much, not the information on the letter. I got a letter in the mail stating that our records indicate you are close to reaching the blank amount calendar year maximum copay benefit through the Xolair drug copay program. As of this date, you have blank amount left. I'm like, oh, okay. I need to investigate what's going on. So I went to my healthcare insurance's website, and I noticed, suddenly they're going to just pass more money on to them. They apparently just started back in March. I didn't know about it, had no clue this was happening, and suddenly the copay assistance program money is drying up much faster. So I called my provider today. I got this letter like the day before we were getting ready to go on vacation. I said, you know what, I'll deal with this when we get back. So I called my doctors or my specialist today, and I talked to someone there, told what was happening, and they said call the copay assistance program, which I did. I called that copay assistance program, and they then transferred me to someone else, and then they told me about what was going on with how much funds are left. I said, well, that's not enough to cover the next injection, which is supposed to be next week. So then they gave me a number to call, and one number leads to another number, and then that number leads to another number, and, well, I'm not going to show it to you, but it's enough. It would fill my entire phone screen. That's how many numbers I had to call today. I was on the phone probably something around 3 hours. What time did it start? 9:45. I got the call back from the doctor's office around, we'll say, 10 o'clock. And then from 10 o'clock until, I don't know, what time was it? 12:45, 1 o'clock, on the phone. Just, nope, sorry, we don't have any funding. Sorry, we don't have any funding right now, but you can join our waiting list. And then another one, which was really miserable, is, what healthcare insurance do you currently have? Well, I said, I'm through the Penny program of... I didn't ask that. Are you have healthcare through an employer? I said, well, no, I have it through the Penny. Okay, are you the marketplace? Are you this or that? And I said, well, I'm through the marketplace. I didn't ask if you're... I'm like, it's really stressful to go through this. And a lot of people are saying the following, long COVID, it's a problem. Did you have COVID? I said, well, yeah, I had it in 2020. Then I had it again to the beginning of this year. She said, yeah, a lot of people with long COVID who has asthma are not being able to afford their treatments because it's just so darn expensive for this injection. A lot of people get different injections, and they're all saying the same thing. Long COVID has really screwed things up. Insurance is not in a good place. Things are just an absolute disaster right now. So basically where I stand, and we're not even going to read this thread anymore, basically where I stand is I'm not getting the injection next week. I don't know when I'm starting the injection again. I'm on several waiting lists. I've called back my doctor's office. They have to call me back again. I canceled the injection. They're seeing if they can do anything. My doctor's office is going to see if they can do anything. It's just ridiculous. It's a really high amount. I'm not going to say the exact amount, but we have to go from there and see what happens, because it's ridiculous how much a month I would be paying for this injection. Maybe there's another route, and there is no real data to suggest what happens if I just stop getting this injection. All could be fine. I could be cured. All could not be fine. Who knows? I still do have coughing fits. Had a few of them in Maine, so who knows what will happen. Moving on, we have a lot more things to look at. Sorry for taking up so much time, but this is the cost of long COVID. The number of people who are on waiting lists to get help for that, to receive treatment for it, is totally ridiculous. We need to do something about that. Back to something else that's ridiculous. First off, measles, 1,033 new cases. I don't believe that's including the 5 new cases in Michigan. Moving on from that now, taking a look at the viral activity levels in Canada. It's low at this time for COVID, flu A, flu B, and RSV. Taking a look now at what's going on with air qualities, they have been ridiculous in many different places, and you will see here that there is a large, but yeah, there it is, wildfire smoke, once again causing air quality problems in Oklahoma, Kansas, Nebraska, South Dakota, North Dakota, Minnesota, Wisconsin, Illinois, Michigan, Indiana, Ohio, other places, Canada. I mean, on and on I could go. It's just bad. And yeah, there are some problems in Oregon, Washington. I don't know. Is this a wildfire in Oregon? I'm going to have to look into that. That does not look to be good. You get the idea. This is bad. Now taking a look at this. Before we get to Pinellas County, Florida, why don't I just show you this? Every wastewater scan site in Florida, as of the time of this screenshot last night, is now listed at high for COVID. Every single wastewater site on wastewater scan. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 wastewater sites, all listed at high right now for COVID in Florida. What's going on in Pinellas County, Florida, as we speak? Sick person 1 time, 2 times, 3 times, 4 times. Unknown problem, many times for that. You get the idea here. Things are not going well in Pinellas County, Florida. Another 852 EMS incidents in Philadelphia yesterday. And I can tell you this, just before I started this video, Montgomery County, Pennsylvania was at 21 EMS calls. Still at 16 right now. Respiratory emergency showing up several times. Cardiac emergency has been showing up a ton lately. 1, 2, 3, 4 times for that. Yeah, a lot of things going on there. Let's take a look at Chester County, Pennsylvania. Not as bad in Chester County right now. And taking a look at Bucks County, you can see it was 11 calls. Is it still? Well, no, it's down to 7 calls now, but you get the idea here. EMS has been really busy. The hospital situation, not bad today for Friday. We'll see if that changes as we head into next week. Actually, this is the best we have seen for a while. For that, taking a look at what is going on in New Jersey, we do see in Hoboken, New Jersey, there's a specialty issue going on at a hospital there. Inspira Medical Center Mannington also has a specialty issue going on. The Northeast, in the coming weeks, I think hospitals are going to start to get busy here as well, because you're going to see today's CDC data that this is not sparing any region of the United States. You know, normally the South and the West would be the worst in the summertime. Let me tell you, we're seeing equally as bad rises now in the Northeast. Probably maybe the best region at the moment, the Midwest. Here's New York State, 607 new COVID cases. You can see the trend line is clearly going up at this time, folks. You can see hospitalizations clearly going up a little better than yesterday, just 1. 307 people hospitalized, 31 people in the ICU. I think the wild card to watch at this point is, will New York State go above 500 hospitalizations before back to school? I think the answer is going to probably be yes at this point, unless suddenly it just stops rising. Taking a look at the Ohio update this week. Currently, there are 86 people hospitalized for COVID in Ohio. Individuals hospitalized, 86 in the last week. And it shows here 79 the previous week. Flu hospitalizations actually went up, 19 versus 15. RSV dropped from 10 down to 3. Good for RSV, but flu and COVID on the rise there. Taking a look at what's going on with some of these wastewater sites. Take a look at this in the South from the United States. Yeah, it's going upward. Taking a look at the regional, and there's a reason why I'm showing this to you today, because what's going on at wastewater scan kind of matches what's going on at the CDC as well. And let's go over to CDC wastewater next and take a look at this. Every region of the United States is going up. Here's the national level. It's going up. It's almost ready to hit moderate levels already. And last year at this time, we were at moderate levels, but mind you, we were very low, and now suddenly we are just going up. The Midwest, it's rising there, not rising as much as some of the other regions. The South is now moderate and continuing to rapidly rise. I would almost want to say it's skyrocketing, because if it continues at this rate next week, it would hit high there already. The Northeast, look at this. Yeah, the Northeast almost went straight up this week for COVID. Yeah, that bad. The West Coast has been zigzagging along, and the West Coast is once again going upward. But I'm really concerned about the Northeast. The Northeast usually doesn't go up this fast until the second half of August to starting of September. So this is something really concerning at this time. All right, look at this. Epidemic status. I'm not going to go here and list all the states, because let's put it to you this way. Here's the number of states that are not either growing or likely growing. 1, 2, 3, 4, 5, 6, 7, 8, 9. I think it's, 1, 2, 3, 4, 5, 6, 7, 8, 9. Only 10 states either not changing or not estimated. The rest of them are either growing or likely growing, and the number that are growing at this point pretty much outnumber just about almost everything on this map. Yeah, Florida, growing. New York State now growing. Massachusetts, Rhode Island, Pennsylvania, New Jersey, Maryland, Delaware, Virginia, North Carolina, Georgia, Tennessee, Kentucky. On and on I could go. Growing now. And look at the Pacific Northwest. Oregon, Washington, growing. COVID is rapidly increasing here in the United States. Things are really getting bad, my friends. Take a look at this. Emergency department visits. They are now starting to go up faster. Yes, they are now starting to go up faster. In some cases, I want to say this is some of the biggest increases we have seen in a long time. And if we continue at this rate, yes, we are following 2023. If we continue at this rate or go even faster, we're going to outpace 2023 at this point. It's just a real quick rise. Variant data, I have to show you this. Again, still not updating. I want to say at this point, maybe XFG has taken over. That's suspicion. There's also an XFG.3. In some countries where that has come along, things just rapidly went upward. Could that be part of the problem? Because if you remember, Pennsylvania wastewater data shows, for whatever reason, LP.8.1 is back to dominating again, but XFG.3 has entered the picture there, and that's not far off from dominating here in Pennsylvania. So, this is a big weekend in the United States, and you're probably going, well, it's not a holiday. And it's a big time for summer vacations right now. In some states, they historically say this is their busiest weekend of the summer for vacations, weekend getaways, you name it. Please, if you're going to go to those barbecues, those family reunions, if all that stuff happens this weekend for you, please be testing ahead of time. Make sure you don't have COVID before you go. Ask the others to test as well. I mean, if you can obtain a test at Walgreens, CVS, does Rite Aid still even exist for you? Rite Aids are closing here. Walmart, if you can get them on Amazon, whatever you can do right now, testing to make sure that you don't have it before you go to any of these gatherings, because this is a really serious. Also, I can't force you to wear a mask. I don't want to force you to wear a mask. You do what you want to do, but my advice to you is, anywhere in the United States and other countries as well, please use extreme caution. COVID is really going up right now. If you do not need to use healthcare, do not use healthcare right now, because it is extremely dangerous. We have not seen things go up this fast in a while. I mean, we're going from what started off to be a slow summer for COVID to now it's like, whoa, things are bad. And guess what? We're going to go back to moderate and eventually high levels very soon here in the United States. Many states have already done so. We'll take a look at some of those hotspots over the weekend. We'll have more updates over the weekend. If you enjoyed today's update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone. Leave your comments down below. Ways to become a Patreon member and everything else is listed down below. And soon to be memberships here on YouTube. I think I'm going to figure that out over the weekend. I will see everyone again tomorrow. Until I see you again tomorrow, please be very careful and stay safe. Take care. Have a fantastic weekend. See you again next time. Thanks for watching.